Good evening, and welcome to House Call with Dr. Gigi. As you know, this is our Tuesday night time to really talk to you all about what's going on in the world of Dr. Gigi. And Dr. Gigi, as you know, is a wonderful. She is head of the Rodham Institute in DC and has been a wonderful partner with us here at blackdoctor.org. However, I will want to say that tonight we have a special show and a special guest, and we're going to be talking about really the mental fatigue that a lot of doctors are starting to feel as it regards to what's happening with this pandemic. And because people don't think about doctors in that way, that they're people and they have their own kind of mental health, their own kind of challenges, and they take a lot of these things with them. So what we're going to do is we're going to explore that tonight, and we're going to talk about, some things that have happened here in the country recently that are trending in a way that was kind of unexpected when we learned about it. But then when you take a step back, you go, it could be something that really is a real challenge that doctors are facing. So before we bring on our guests and we bring on Dr. Gigi, I want you to do a couple of favors. First of all, in the comment section, let us know where you're watching from. We always like to know where people are watching us from all over the country, and we'd like to give you a shout out from where you are. Also, if you have somebody that you know needs to watch this show and get this information, tag them, share it with their friends, share it on their pages so they'll get to know. And also, finally, number 3 is I need for you, if you have any questions, please put those in the comment section so we can ask our guests. We have some wonderful guests, author, personality, public speaker. She does everything. So we got a wonderful guest, Dr. Yolanda's coming on. But we have to start the show with Auntie Gigi, as we like to. And we're going to add Auntie Gigi. Hello. How are we?
I'm fine. And you know what? I just want to say thank you, Mr. Ellis. And I am just so happy to be here because I've had a day. Now, I have not touched up my makeup. You don't see any lipstick. I just finished scarfing something to eat. And, I was so looking forward to our conversation tonight with Dr. Yolanda because this is not just for doctors. This is really for clinicians and actually for anybody that's in a caretaking role. So this can apply to parents. It can apply to, any number of people. Of course, clinicians, we have our unique things, and that's what Dr. Yolanda is going to talk about. But anyway, I just want to reintroduce myself. I'm Dr. Gigi Elbayumi, professor of medicine at GW in DC, also the founding director of the Rodham Institute, which is dedicated to improving health equity in DC. And I'm going to just share with you a little bit of my day because, honest to God, I was just joking. This is actually coffee that I did not have from this morning, but it could be something else because that's the kind of day I had. Right. I'm just going to take a deep breath and just it was one of those days that I don't know if it's the full moon. I know we had a full moon, and people in medicine, we in medicine always talk about the full moon because we know when there is a full moon out, things do get crazy. It's not just a myth. It is real. It is a real thing. You talk to anybody who works in an emergency department, you ask anybody in healthcare. Well, it's been a full moon, and it's also been COVID and Delta and, people just losing their cotton picking minds, right? People have lost it. And, I don't say people, I'm saying people, myself included,
Right.
Because I had my patients and I'm having people, I just had one of my patients text me, you need to get a pre-authorization on on my medications. I said, would you mind just reaching out to me during working hours? I'm just now getting home. Right. And so much pressure. But the thing that is really, I think, what Dr. Yolanda is going to be talking about is what is it for those of us of color who are in the healthcare profession? What is the extra? So I'm going to share 2 examples from today. So one of the young ladies that works with us as part of the team, an administrative assistant, a real friend, I love her. She had a breast biopsy. And, for the last several days, she's been I'm not her doctor, but she said, look, I give you permission to look in my chart. Can you give me the results? not back, not back, not back. I got this crazy day, but obviously she's worried. I went in and checked, and it was negative. She was, it's like the release of everything, the
Right.
release. I just held her and she was crying, and I just gave her whatever, however much time that she needed, because, it's like all the stuff that she was carrying and holding on to. And so that was something. I mean, I was glad to give her good news, but even good news is stressful. You know what I mean? It's that release. And then my last patient was a gentleman who'd had cancer before and found a lump in his breast. And so dealing with that, and he was crying the whole time as I'm examining him.
Right.
Crying, and he's in healthcare too. Crying, crying, crying. I brought in his friends. They started to cry. It's a lot. And I mean, I'm glad that people cry, and especially men, because it is a release,
Right.
I mean, it is a way, and, people may not know this, but actually when they have analyzed the tears, don't ask me how they collect them, little test tubes. But all kidding aside, when they analyze the tears that come from sadness or frustration, they actually are filled with toxins. And that's why it's so good to just release it, get it out, versus tears of joy, which is salt water, basically, right? But so then when I was driving on the way home and just barely got to my seat and sat down, and, I was like, I am so glad that I'm going to be talking to Mr. Ellis and Dr. Yolanda, because this is going to be my therapy session. And I thought it was important to start off this way, because I think we have to keep it real, and we can't, I mean, especially in this world of social media, everybody wants to present this, this facade that everything's perfect. And first of all, it takes a lot of energy. And when you get to be my age, it's like, forget it. What you see is what you get. But I do think that it's important that we kind of share, and especially, we're two physicians, Dr. Yolanda and I, but this really applies to so many people. But maybe the added burden on physicians is that people kind of put us like up here, like we know it all and we have it together, and we're just like everybody else.
We have good days and bad days. Well, physicians have good days and bad days like everybody else does, right? And the hardest part about that role, and we're going to transition to our guest, which is Dr. Yolanda. The hardest part about the role as a physician is that you're carrying not only your own burdens of your own life, but you're carrying all of those patients that might have some health challenges, that might have some difficulties, that has their own kind of, and they bring it into your office with them. And not only you're treating them, but you're treating what they're dealing with on a daily basis, and you're carrying that burden. And so sometimes that's a lot, especially as we're transitioning to. Dr. Yolanda wrote a book called The Triple Pandemic, and she's going to explain to us. She's not a stranger. We've seen Dr. Yolanda here on Black Doctor here before, but she's going to explain to us what the triple pandemic is and how that impacts physicians and we're going to say healthcare professionals in a very profound way, and to try to share some of those insights so you can really get a feel. We're going to let you behind the curtains like we do here on House Call with Dr. Gigi.
But you know what? Can I just say a few intro words about my friend, Dr. Yolanda, because really She is fierce, okay? You see her, she's beautiful, she's smart, but she's beautiful inside and out. So she does this once a year gala, and by the way, she looks fierce in her all red, where she is really educating all of us, including the community, about how heart disease actually starts in children. And she is a pediatrician that is an obesity expert that also works in Ward 8, and she lives in Ward 8. So she's not just kind of out here saying something. So when she told me about the book that she was writing, and, of course, it's the triple pandemic, but it's a focus not only on clinicians, but clinicians of color, because we really do have an added burden. Before I turn the floor over, I'm going to tell you, I actually forgot about this, and it just tells you how overwhelmed my day is. I started with my day with hearing about a patient who declined getting the COVID vaccine. He's got a 10-year-old. got his COVID vaccine on Thursday, and I got a call from the ICU doctor taking care of him, but he just got intubated. And so, for us of color, I'm not just thinking about him as a patient. I'm thinking, man, why did he not get the COVID vaccine? And then I'm thinking about his wife, but about his 10-year-old little girl. I'm like, this was totally, so to us, I think, and Dr. Yolanda, I'm going to be quiet, it is personal when people get sick.
Yeah. I like, this is, first of all, thank you for having me on. Thank you for helping me, Dr. Gigi, with this very important topic. Like you said, Ellis, this is Auntie Gigi, Dr. Gigi, my mentor, my friend. I absolutely love this woman. And she's so great and gracious and calls, me fierce, and, who you get these things from when you have a mentor and you see how passionate they are and how effective they are, and you literally sort of model yourself after them. So that's who she is to me. But this book, it's actually navigating a triple pandemic, and I when I wrote the book, I actually started off, it wasn't a book, it was my own personal memoir. I sat down and I thought, I'm going crazy. I don't know. I'm showing up every day at work. I have the white coat on, and because I have the white coat on, everyone thinks I am immune, because that white coat basically says, like you said, we have it all together, right? It looks like we have it together. We have the stethoscope around our neck. We walk in and we ask, how can I help you today? And I kept walking into rooms going I would say out loud, how can I help you today? And I kept saying to myself, no one's asking me how they can help me today. I need someone to ask me how they can help me today, because I want to share what I'm going through, what I'm feeling. And so it really sort of started off just being overwhelmed, patients after patient after patient. And I could tell stories. I had one girl who had gone to, the grandmother had brought 3 young ladies to me. They were sisters. And their mother was in a medically induced coma from COVID. And so they were all coming to be COVID tested. And they were my personal patients. And I'm going, what do you mean your mother is in a coma? So I'm trying to act like this is a normal conversation, and I'm just going to do your COVID tests. And the youngest is about 6 or 7. She starts crying. I start crying. We're all in the room crying. I have 5 to 10 minutes for this visit that I'm supposed to swab, do a COVID test, and get to the next patient. That clearly is not going to happen. So the grandmother and I have this conversation, and I'm talking to the girls. I'm giving out my personal telephone number, telling them to text me, call me if they need anything, because I've known them so long, and they were devastated. So this was all going on during this pandemic. And the point that I'm making is that what this book did for me is I needed the world to see our vulnerability. I needed the world to see that we literally are out here fighting, seeing patients, literally in some of us in fear and anxiety of our own health and our own wellness, but we're showing up because it's our community. Our community was being hit the hardest. Everyone that was coming in looked like me, or looked like my children, or looked like my parents, my aunts, my uncles, my brothers, my sisters. So there's no way that this was not personal. And what ended up happening is I thought to myself, I can't be the only person feeling like this. And on top of all of this COVID stuff, let's be real. What happened was we were all sitting at home during this pandemic, and we watched George Floyd get murdered in front of our eyes. That was traumatic. I had PTSD after that. I was afraid every time my son would grab a skateboard and want to go outside, but I couldn't tell him that I feared for him. So I had to let him go, but I'm sitting at home scared, wondering what time he was going to get in. And, this was something he'd done for years. And all of a sudden it gave me extreme anxiety, couldn't sleep. So anyway, there are all these things that were going on. Ahmaud Arbery was killed. There was just so much going on. I said, I can't be the only one that's feeling this. I reached out to a few colleagues, and clearly I wasn't. And what I love is in this book, Navigating a Triple Pandemic, we're not just talking to doctors, as Dr. Gigi said. I actually have nurses, pharmacists, nurse practitioners, people who are in research, scientists, everyone who I knew or who at least reached out to me and said, yes, I want to talk about this. And the triple pandemic was that we as healthcare workers of color, we were confronting racism in America.
Mm-hmm.
That was one pandemic. That's one that's been going on for over 400 years. Health disparities in medicine, and the trauma of COVID-19. And truly, there was an intersection of all three as this was all happening, because here we are with the racism and the inequalities is what led to all of this disparities in the healthcare system. And with these disparities in the healthcare system, who was hit hardest? The Black and brown communities. Right, and so the extra burden is, this is where some of us chose to work. This is where I have decided to put my life's energy and work and my purpose and my passion into communities of color, vulnerable communities. And I could go off and work anywhere, but this is where I've chosen to work. And so because of that choice, it was a harder day. It was a longer day. It was a much more personal day. And I felt like somebody somewhere has to, be commiserating with me. And I'll tell the quick story is I decided, you know what? I am having this is challenging my mental health. I think I need to speak to someone. I actually reached out, set up a virtual visit. It's such a true story. And I thought, let me choose a doc. And I decided I wanted to talk to a Black woman that was a psychiatrist. So they set me up with someone. I get on the first call and I tell anyone that I speak to about this, if you had listened in at around minute 5 to 10, you wouldn't have known who the patient was. Because when I said to her what I was feeling and how I was going, she literally sighed it was like a deep sigh of relief and said, girl, me too. And she began to unload, and I realized she couldn't tell anybody else this.
Right.
She had patients that were telling her how they were feeling, what was going on, and she had to pretend that entire time that she had it all together. And when another clinician, another Black woman told her that I was fearing for my son after I saw, George Floyd killed in front of me, and the last words from his mouth were mom, mother. It haunted me. And after stating that, she said, girl, me too. And I went, wait a minute. The mental health specialists need mental health specialists, right? The doctors need doctors. The nurses need to be nursed. So one of the things that I got involved in is this Heal the Healers campaign, as a matter of fact. Talking about building resiliency and dealing with stress and transcendental meditation is one of those resources that I've been using for that very reason, because in everybody's story that we told, and in the first book, it's 15 of us, and here's a copy of the book. So it's 15 of us that told our stories. Every single person without fail mentioned George Floyd or something that was going on with George Floyd or Ahmaud Arbery. The last few people, because they were just finishing up before we published the book, even mentioned January 6th in the Capitol. So they were thinking about all of these sacrifices that we make every day. And we're constantly facing this racism and this discrimination and the inequalities, and how absurd it is that we're going out of our way to save this country, and this country doesn't love us back. We love this country, and the country doesn't love us back, right? But we love the people of this country, so we're going to obviously do this work. Every single person also mentioned what gets them through. Almost everybody said something about God, something about their prayer life, something about a saying that their mother or their aunt or their grandmother has instilled in them that made them remember why they do what they do. right? Because we have to have our why has to be greater than what we do every day in this community. Because if your why isn't big enough, you're not showing up every day. And if you show up, you're not really there. I'm just going to be very honest with you. And every single one started to talk about resiliency factors. What are those things that kept them going outside? And most of them, it was some form of either releasing stress or recognizing that they hadn't figured out how to release the stress. And another true story for me during this pandemic is I actually walked 500 miles in the month of July. Like one of the things that I wasn't getting any notes done. I was on every bad list of the hospital for things that just my documentation wasn't done. I wasn't because I wasn't well. I wasn't well. Like, you know, Dr. Gigi's raising her hand. I wasn't well. The last thing I loved my patients, cared about my patients, got their prescriptions in, but finishing the note, very low on my totem pole. And yep, you see me on my social media, and right after work, where was I? I was walking across the bridge, and I was purposeful about it because it gave me a sense of accomplishing something. It made me feel like I was actually taking some kind of control over my life because everything else was out of control. And so after the 500 miles, I was like, I have charts to do. I have some stuff I need to get back to. But that was a part of my healing. And so I don't know, you know, how much, but I don't want to like completely bombard all of it. We could, there are some questions I'm sure that want to be asked, but we came together, we wrote this book. And Dr. Gigi, like I said, such a special person to me. My mentor, huge cheerleader of mine, I'm of hers. And the first person I thought about when I said, hey, I need someone who is in this fight with us, who understands what we're doing and why we're doing it, to write the foreword. And this blessed, wonderful woman did that for us. And it was perfect. Like it's, you know, you send someone some points and you ask them. I didn't have to do any of that. It was spot on. She made references to the same sort of unknown in terms of the era when HIV, when we were first dealing with HIV and we didn't know what we were dealing with, and communities of color and vulnerable communities were hardest hit, and you know how we had to respond to that. She made connections to that and just the disparities in general. But the thing that was very special is the first thing she said was, other people need to read this, meaning those who are going to come behind us in healthcare, medical students, residents, this should be required reading. People need to know these are the extra burdens. This is the extra stuff. This is that black tax that we talk about when you show up and it's not just you, but you're showing up with your family and your community and everybody else's needs and wants and desires. You have to bring all of that to the table, because we all know that the saying is you get your foot in the door and you're supposed to open it for everybody else to come through with you. And you don't do that unless you create a place and a space of healing and safety for them behind you, because you don't want to just bring other people in just because they look like you. You need to be doing some work in that space. So when they do come in, they're coming in with higher wages, better conditions. They're not expected. So all of that stuff is the black tax. That's that stuff that we're working on constantly that our white counterparts just don't have to think about,
Let's talk about some of the responses that's happened to, there's a saying that says you can't pour from an empty cup, right? And so right now we have been emptying our souls, we've been exhausted mentally, right? And so now we're still trying to fill and pour from that empty cup. But what has happened is one of those pandemics that you talked about in your book in terms of the COVID pandemic is, from a medical perspective, a lot medical healthcare professionals feel like it's preventable, right?
It is.
Getting them vaccinated.
We don't feel like it is.
Getting
preventable,
vaccinated,
right?
is a big part of that, but people are still pushing back, and we all know about all the misinformation and things that are going out on the internet. But what's happened as a reaction is there have been some doctors that have said, you know what, enough is enough.
Enough is enough.
So we had some, I don't know if y'all have heard about this, but there's been some doctors down in Florida, about 70 or so doctors that walked out and said they're not doing it.
Symbolically, let's make sure we say that, because there's some people that are saying that they walked out and they're not seeing patients, and that's not what happened. But there were 75 doctors or so who had to take a stand of solidarity and say, we have to make a point. You have to see that we can't keep manning these stations. First of all, we're not robots. We're not AI. We're not here, and we won't be here indefinitely. Doctors are also dying. Police officers, everybody who's on the front line, we're dying. So doctors are dying, nurses are dying, teachers are dying, police officers are dying. And why are we dying? We're dying because people are refusing to wear masks, to get vaccinated, to do the protective things that they need to do. And so these doctors said, right now, all of the ICUs are filled with people who are unvaccinated. 99% of these admissions in ICUs, they're unvaccinated. And here's another thing that I read about Florida right now. In Florida, they're actually putting out a mandate to cut back on water usage. Okay, why are they doing that? Because they need the water for certain respirators, the humidity, the mist respirators for the ICU beds. So it's now starting to affect quality of life. These decisions that people are making are affecting the quality of life. Just like not getting vaccinated and not wearing masks are affecting our children being able to go back to school. Today alone, I had several crazy cases. Dr. Gigi and I just started off this conversation commiserating because it was such a hard day. I had over 30 patients. Almost all of it was COVID related. I promise you that. But one of my kids, well, actually several, came in because somebody tested positive in their class or building. So let me get this straight. This is what the policy is right now. If a kid test, not the child, but someone in their class or in the building test positive, every child in that classroom has to be out for 10 days. The parents are pulling their hair out. They're like, wait a minute, we're finally back in school. But every single time you get a case that's positive, these kids are going to have to stay at home for 10 days. This is going to affect every parent. So for every child, there's 30 in a class, there's going to be 10 days out. And inevitably, all of these classes are going to have several kids that are going to test positive throughout the year. So we have no idea how much interruption that these kids are going to have from these positive cases. And the kids who can't be vaccinated are counting on the adults to get vaccinated, wear masks so that they're not transmitting COVID-19 to the younger children who are right now not eligible for vaccinations.
So Dr. Gigi, let me ask you this: as whether the walkout was symbolic, we know there was a doctor in Alabama that said he's not treating anybody that's unvaccinated that could present with COVID. He just put his foot down. How much of this is? And I know you take a Hippocratic oath once you become a doctor, and that basically the layman's term is you pledge not to do any harm to anybody. Is that in violation of that, or is it just the epitome of the frustration that healthcare professionals are feeling when you have something like a pandemic that in this country in particular is very preventable, and people are still choosing to not take the steps to prevent getting infected or getting children infected?
Sure. So a couple of things that I would say about that, and that is 99.99999% of people are going to work, taking care of patients, and even the ones that walked out, it was a symbolic walkout and they came back to work. So I, was doing my residency training. Well, actually, I was a medical student when AIDS first, became recognized as an issue. And at that time, there were physicians and dentists that outright refused to take care of people. Okay. Because at that time, remember, HIV was a 1 year, 100% death sentence. People were all dead within a year. I thought it was highly unethical to do that because even though, we didn't know how it was transmitted at the beginning, I just felt that, that's part of our responsibility. That's part of our oath and so forth. So that was in that setting, right? Where people were, really dying and we didn't know, we were trying to learn. I have to think about how I really feel about people refusing because I'm of two minds. On the one hand, I get it. I had actually a colleague of mine who is a cardiologist and she has some health issues. And this woman who was exposed to COVID and, is coming in with symptoms. And she's like, first of all, at our institution, you go someplace else to get tested if you think you've got COVID. And it's like, really, you're coming in, you're not vaccinated, you've got probably COVID, and you're exposing me and my health, which is going to impact not just me and my family, but all the future patients that I'm going to see. So I am, I know what I will say because of my ethics, but that doesn't mean that I'm like, you've got to be kidding me. I will continue to see patients as long as I'm able to, but and no matter what. However, I think that there has become just some really sad and selfishness that's going on. And, the Rodham Institute is part of the Black Coalition Against COVID. And we had to do kind of educate ourselves about how we were going to respond to kids going back to school. And of course, we said kids have got to go back to school for their mental health, for their well-being, for their education, and in some cases, for their safety and for their eating, right? Because some children come from chaotic households. But I do want to say we are shifting and we're going to use guilt as a way to get people vaccinated because of a statistic that I'm going to share about kids. So we know that Delta is not more deadly, but it's so much more infectious that there are going to be a lot more kids getting infected. And we just heard from our friends at Children's Hospital today, the numbers are really beginning to go up. Now, mind you, there's always a lag time of death. First, the hospitalizations come, and then a couple of weeks later, the death starts to go up. So it is the adults that primarily get the kids infected. It is us. So if you don't care about yourself, you got to care about the kids. And listen to this. For some reason, and Dr. Yolanda, correct me if I'm wrong, for some reason we don't understand why Black and Latino boys die more often from COVID. Just like Black men and Latino men do. Black people and Latino people die more compared to their white counterparts. Indigenous people die really at an even higher rate, but we don't quite understand why Black men and boys and Latino men and boys die. So imagine, Dr. Yolanda is worried about her son. I'm worried about my nephew and my brother. Sometimes, gets hot-headed. I got to tell him, calm yourself down. You cannot afford to be hot-headed in this day and age. Anyway, so if people really care about their Black boys and Black young men and their Black family members,
neighbors,
about them then, right? Then get vaccinated. Because you can't say that you care about Black boys if you don't get vaccinated. So we're going to use whatever means necessary, including guilt. But I want to make a point that I think is important, and of course it just escaped. It just flew right out. See, that's what happens when you're tired. Oh, this is what I was going to say. So one of the other experiences, being a clinician of color, that has really been taxing, is we're operating within a medical apartheid system.
Mm-hmm.
So I've had many patients, at the beginning of the, the wave and the surge rather here in DC was in May, that I had to get transferred from other hospitals. And you know what I say? I said, this is my VIP patient. And so, of course, when you say the word VIP, check this out. People are like, oh, the VIP? Yes, this is the VIP that's coming. And I've, we can't overuse this. We can't let this
Right.
this
Right.
Trick get out there. But, because they are VIPs to me.
Right.
And in a few weeks, hopefully we're going to have as a guest Pastor Webb, who also just wrote a book called Dark Shadows, My Journey with COVID, and she'll tell you, I had her transferred. So it's the double, triple, quadruple pandemic of not only all the things that we face, but also having to navigate people through this system, which is inherently racist, right?
I mean, case in point, Dr. Susan Moore. Dr. Susan Moore,
she's from
internal medicine.
God rest her soul, from Michigan, my alma mater.
Yes,
God rest
she
her
was
soul.
an internal medicine physician, Black woman, who's a doctor, who knew what her symptoms were, who knew how to navigate a healthcare system, but a racist healthcare system, your hands are tied. So she has COVID symptoms, knows what COVID symptoms look like, knows what pain is, how pain should be treated, tells I think it was in Indiana, tells the healthcare system, tells the doctors what she's experiencing, and no one would listen. And so she had the wherewithal to document how she was feeling, and that she felt that the treatment was racist, and that they weren't attending to her, that they sent her home too early, that she had to come back. All that being said, this woman died later of COVID. And what's interesting is when I read her story, I didn't just finish there. She died of COVID, and she left behind a 19-year-old son who had just graduated from high school. These are the victims of COVID. Just like for me, the reason I am so adamant about heart disease is because when we die early, or we are morbidly ill, and we cannot, we have this morbidity, we can't do the things that we should and want to do for our children, they become the victims of these chronic diseases and these deaths. So we leave this earth too early, and we're leaving behind 10-year-old daughters. We're leaving behind 19-year-old boys who have to now figure out how to navigate this world without us, in a world that is not for them, that is already against them. And so I'm so frustrated, and I get so passionate about, these kind of illnesses, diseases that are preventable. Heart disease is very preventable. Diabetes is preventable, type 2. And so is COVID. So here we are with these preventable diseases, these things that we could do to mitigate them. And we're not, and we're leaving behind literally just bodies, in terms of our kids who have to now fend for themselves. And so it just,
there's a couple of questions. So one question is, what makes this
this is your therapy session?
Yeah, I was like, I want to be able to get,
for sure,
the audience in that's watching it, because for the most part they're loving it. So there's a question from one of our YouTube viewers, and he said, what makes this pandemic more, I don't know what the more is, than other pandemics, and why don't I ever know someone affected by it? And so I would say this, because I don't know where you live and what your demographics are. I can't say why you haven't seen anybody that's affected by it, because there's been a number of people that have been affected by it. And sometimes people don't tell you, right? Because I know I've worked with people virtually, and I didn't know that they had it until they mentioned it, right? And so somebody might be in your circle that has had it and kept it on the down low because of the stigma that could come with saying, hey, I had COVID. Now, some people have turned around surviving COVID as some sort of badge of courage, as to see you can survive it. There's that too. But I would say what makes it bigger than any other pandemics. Well, the last time we had a pandemic was 1918. That was the I'm going to use quote unquote Spanish flu. That's what it was called. And there's a whole nother story behind that. Do your research on that. There's some great articles about the Spanish flu, but that was the last real pandemic. This particular pandemic was a confluence of multiple things, the coronavirus being a highly mutating type virus, and then the previous administration kind of cutting back on resources that were utilized to identify these types of viruses as they pop up around the world. And reason why Ebola, for example, wasn't as bad as it could have been is because we were able to catch it early and take really decisive directive action in terms of reducing Ebola and getting it out there. So even though a few people got it, it wasn't nearly as big as it could have been. This particular virus got out, and because it's highly, contagious and it mutates a lot, that's how we got it, and it's worse. But again, it is extremely controllable by getting vaccinated. We have some wonderful vaccines that we know, and we're going to talk about that. That's the next question I'm going to ask you, is that the Pfizer vaccine has been fully authorized. So that's going to remove any excuses in terms of saying it's experimental. Pfizer has been fully authorized for people 16 and up. Okay. It is still under emergency authorization for 12 and up, but it has been fully authorized for those 16 and up. And so this is really, really preventable. But why is this different than diabetes or hypertension that are also preventable? Well, those are individual decisions. If I choose to eat a lot of foods that are high in fats, high in cholesterol, that is an individual decision that affects me. Yes, I have my family that gets affected by it, my constellation of people and friends and peers or whatever, they get affected. It's still a very contained illness. What we're talking about now is if I am cavalier about wearing a mask, about washing my hands, about being vaccinated, and I can go out, I can infect so many more people that I don't know and be the catalyst for their demise. That is where it's different, in my opinion, with regards to any other thing that is, like smoking or anything else that you're doing that's detrimental to yourself. We cannot, and that's my question for you, Dr. Yolanda. When does a personal decision, because getting vaccinated still is a very personal decision, when does a personal decision cross that line into, hey, we got to make a public health decision like mandates, and some employers and universities, things like that are putting in mandates.
You just made the perfect example, right? With smoking. When you do something that is a personal decision, but it affects others, that's now a public health concern. That's when it crosses the line. And here we are. No one said, do you know how hard people fought? Do you remember how hard people fought? It was their own personal decision. I can smoke if I want. Everyone knows you can't smoke and it's contained around you. We always, as a kid, as a educator, I would always say, smoking and thinking it's staying just around you is like watching someone pee in a pool and think that the urine is going to stay right around them. No, it diffuses all through that pool. That's exactly how smoke does. So with mandates, there were times when people did not want to be told where they could and couldn't smoke. I just came off of a trip and the entire hotel was smoke free. They used to have smoking floors, but you could still smell the smoke when you were above or below the smoke. Everybody knew this, and it was affecting others. Why? Because secondhand smoke also causes cancer. It was killing people. This is the exact same thing. So it is so amazing. We have mandates on so many things that does affect other people when they make a decision. But all of a sudden, we don't think that we should do that with this vaccine. The same goes for seatbelts. When I had my first daughter, I'll never forget it. I just got married. And my father-in-law, older, comes to pick us up and had no car seat. And the nurses said, well, no. They can't leave with you. You don't have a car seat. And his response was, well, what do you mean they can't? Like, it's her baby. She could leave. And I'm like, no, there are laws now. But when he was a new father with his wife and their child, his wife got in the front seat with their infant child and they drove off from the hospital. And his first response was, This is your child. This is your decision. Guess what? The law says they cannot release me out of the hospital without a car seat. So he had to take the key, go get the car seat, bring it back. And he was literally mind blown, incredulous. He really was very upset about it. But I was like, this is just generational. It's just a change. But these are the things we're talking about. We have all had laws put into place that affect our personal decision when it comes to death, killing others, maiming others, and survival. And so it is amazing that we are now all of a sudden incredulous about this vaccine. And the last thing I'm going to say about what you just talked about was extremely funny because it happened with me with a patient today. 15-year-old kid comes in, he's getting his well child visit. And I said, oh, so you're eligible for the vaccine. And so he was like, yeah, but I'm not quite sure I'm going to get it yet. Now, mom is vaccinated, dad is vaccinated, but he was trying to decide whether he wanted to be vaccinated. So I asked him with his mom in the room, we said, so what's holding you back? What's the decision? You know, what's it based on? He said, I'm kind of waiting because it's not FDA approved. So I opened up his phone. I said, oh, Google it. Just yesterday, they approved Pfizer. It's now FDA approved. And he was like, it is. I said, yep. Pull it up. I want you to see it because I wouldn't tell you anything otherwise. And it was like, this is so great because he said this today. And I said, but by the way, what does FDA stand for? He didn't know. Okay, what does the FDA do? So why are you banking on this FDA approved? I said, so you're not even sure what the FDA stands for. You're not even sure what the FDA does. But somehow you believe, and it's great that you have some guideline, but you believe because it's FDA approved. I said all of these weight loss suppressants, these weight loss supplements, these weight gain supplements, all this other stuff and junk that y'all are taking, they're not FDA approved either. But people are constantly consuming things that are not FDA approved. And all of a sudden, that was his measuring stick. And when he looked it up and saw, guess who got his vaccine today? Because it's FDA approved just yesterday.
Well, it's the sound bites. And it's
exactly. That's exactly right.
We've got TikTok and we've got Instagram. And then you get those 1 minute or 2 minute videos.
Absolutely.
And you get all this, and you get talking points, but you don't context. Context are taken out of talking points, so you can say yes. In the grand scheme of things. So for example, one of the biggest talking points was the numbers started going down, and so people felt like, oh, I don't need to get vaccinated. Right? Earlier in the summer, when the numbers were going down, the death rates were going down. Well, outside of context, you say, oh, they're going down in a general sense. But when you control for the people that were vaccinated, the death rates were the same with regards to people that were unvaccinated if they got COVID. So people that were just getting that soundbite that says, oh, the death rates are going down, see, it's not that big of a deal, those numbers were including all the hundreds of millions of people that were getting vaccinated, and they were affecting the overall numbers. When you pull out the vaccinated people, the numbers stayed exactly the same with regards to unvaccinated people and the rates of death that was happening. And so what we have to do, and what the burden that many healthcare professionals are dealing with on a daily basis, is they're having to apply context for everybody else out there. Social media doesn't have to. Social media doesn't carry that burden of having to apply context. We have to do that. I'm saying I'm including myself loosely because I
and you are a part of this education.
Yes, you are, for sure. And just going back to the book Navigating the Triple Pandemic by Dr. Yolanda Lewis-Ragland, is that we then have the extra responsibility, right? Because we know that just because we are showing up and that we are a trusted voice with a common experience, people are going to listen to us more likely to listen to us anyway. And so when people talk about, I'm not going to take the vaccine because of Tuskegee, well, first of all, we know what Tuskegee is, and we can say, well, you know what? Tuskegee, people did not get injected with syphilis. They were actually prevented from getting treated for syphilis. And P.S., there is an ad called the Tuskegee Project, where the descendants of 6 families of Tuskegee are actually promoting COVID vaccinations. And they talk about, they said, we don't want our family's name to be used in vain,
Right.
to not get
If
vaccinated.
you want to watch any of those videos, they're on the blackdoctor.org YouTube page.
They are just amazing. I actually saw them. They spoke at Howard, and it was just, it was sad, because it's like, really, we got to have this conversation again.
Mhm.
But I was so honored to be in their presence, just to hear, first of all, to bring these men to life as fathers, as uncles, as, brothers, and not just some kind of anonymous thing. But we as clinicians of color, we have to be so aware of all these other things that our white counterparts don't have to be. We have to be aware of the social media in real time, because we have to deal with the myths, right? About any kind of myths that are out there. We're focused on COVID these days, but the reality is, as a doctor for adults, how many patients are now coming up with cancer because they didn't get their mammogram, because they didn't get their colonoscopy? So because of my deep love for all my patients, but I know that it may take a little extra to get people who are not always treated so kindly, right? Where there are inequities through our medical apartheid system, that takes energy. And as you can hear from Dr. Yolanda, we care very deeply, but we're also human beings. When our discretionary time is less and less and less, because we feel so, that this is so important. And Dr. Yolanda, I am 70 notes behind. And they are writing me, telling me the billing. I'm like, okay. But I got to do this webinar tonight, or I've got to take care of this person tonight. Or look, I've gotten 3 texts from patients since I've been on this call. Can you, et cetera, et cetera. So,
as we're wrapping up here, because I promised y'all an hour. So, but I will say this. So we've talked about the frustrations, right? And we've had our sessions, right? And these sessions could go for about 5 hours, but I will say this. So let's talk about solutions.
Yeah.
So Dr. Yolanda, I'll throw it to you. What can doctors do? What can healthcare providers do? What can regular people do to relieve the stress of this triple pandemic that we're all dealing with right now?
So I think there are a few things that I have in my toolbox that I share with people. One is community. One is actually recognizing that we're not in this alone. We don't have to grin and grin, and we don't have to walk around with this S on our chest as though we're not being affected. What I found in doing this book and doing this book in a community, and not just holding on to it to myself, but talking to my colleagues about it, is that we were each other's best resources to be able to relate, talk about what we're going through, and just really put it out there and be vulnerable and be human about it. I think that it matters that we do that, not just with ourselves as clinicians, but I found that it's actually really helpful to do with our patients. Not so much that I come in and I'm falling apart, but that I'm very honest about how tough this whole thing is for all of us. Because I think that they also get the opportunity to recognize that we really do honestly care. And it's, I think, I think it's drawn a lot of us closer, because we're all having the same experience, the shared experience. Mm-hmm. The other thing is something I mentioned earlier: find an activity that is stress relieving, or a few activities. One that I am very passionate about is transcendental meditation. And I've already said, Dr. Gigi, I'm taking you with me. We're doing transcendental meditation. But meditation, anything that's building resilience, because we have to understand, we have to heal the healers. The healers, this thing isn't going away. The numbers are surging. We're just having this conversation, right? We are feeling like we want to walk out, but there are things that we can do that help calm our stress, things like meditation, things like prayer, things like eating right. We're so stressed that when you're eating bad foods, sugar, carbs, coffee, because it actually adds to the problem. So this is a good time to start drinking your water, right? To start getting real rest, to commit yourself to 6 to 8 hours. Commit yourself to alone time, down time. And as Dr. Gigi and I were just talking about, not take everything so serious to the point where, some things are going to fall. We got to be okay with it. I'm okay with being behind on my documentation right now. I just have to be, because I give more time to my families that I'm seeing, my patients. And so which one of those do I value more? Yes, I want to do documentation, and I want to make sure that the hospitals and the centers are making the money that they're supposed to, but I also value the patients. And so when I need to sometimes make that decision, it's okay to do that. And I think that as physicians and as clinicians, we have to sort of let administrators know that's important to us, that we're here for our patients and that we're able
But you said something very important, Dr. Yolanda, which I really appreciate that you shared, and that's that you said that you sought out a mental health clinician.
Absolutely.
And I think that one of the shames that especially clinicians have, and I think probably doctors the most, is that we don't admit when we have mental health issues. And we definitely need help with anything if we take medications for that. Because people are like, oh, well, I'm strong and my brain and this and that. So for you to say that, and for me, I certainly have seen a therapist, and these days I say I need a touch up, just like with the hair. It's like I need a touch up to maintain. And also because sadly, some people, when they do feel boxed in, they do feel like they've got to do everything, and they don't have an out, that sometimes can lead to self-harm in the ultimate, right? With suicide.
Suicide in doctors is very high.
One of the things that one can do is say, you know what? I need to take a couple of months off. Now, that may not be something that people can afford, but really, if it's your life versus, continuing on this path of just not being, I would encourage people to say, you know what, I've got to have a timeout. This is just too much. And I will tell you this, true confession, after my day today, I only had 4 patients scheduled because I have other things going on tomorrow. I called my assistant. I said, I'm sorry, I just cannot. Can you please just reschedule? It was nothing urgent. They were physicals. So I don't want anybody to think I'm not doing my job. But I'm like, uncle, I cannot. I can't. So I think that, so I appreciate your honesty about that. And as somebody who takes care of a lot of physicians, first of all, a lot of physicians are on medications for depression, for, all kinds of, medical issues, but for mental health. And a lot of people do see therapists. They may not tell you, but we need to get rid of that stigma, especially among clinicians, because I think it helps our patients, right?
And I'm going to tell you, double clinicians, not just in clinicians. You already know mental health in the Black community is already hard to admit. So not only do clinicians not say that they need mental health help, but Black and Brown clinicians are the last to say that they need and sought out mental health help.
So look, I'm on the tribal council for Taraji Henson's Henson Foundation. So hopefully we can talk about the great work that she's doing to really not just increase awareness and get treatment and resources for people, but what she does that's so great, her foundation, is really she's looking at the different subgroups and the special tailored care that they need. And actually, one of the things that, we were just talking about the other day is a Heal the Healers program that they're going to do. Yep.
So you heard it here, Ellis. I'm already signing up for that, right?
Hey, I'm at the top of the line.
I've got my book that I read. It's called Surviving Compassion Fatigue. This is a wonderful book. So if you are of any type of practitioners, and I saw some doctors in the comment section. So this is a wonderful book, and it kind of talks about when your cup gets empty as a care provider, and how do you recognize it? Because I think the most important thing we have to talk about is we have to recognize when we're not operating at full capacity, and we're not giving everybody. We're giving a little piece to everybody else, but we're not giving everything. Number two is we got to recognize what is truly self-care. Going to get your hair done and your nails done that you've been doing on a regular basis is not self-care. That's maintenance. That's not self-care. Self-care is a deliberate.
Although
No,
tomorrow it's going to be self-care because look at my hair.
It can be, but I will say this, is that self-care is a deliberate act that you're going to be intentional about stepping away and taking care and recharging your batteries, whether that's a vacation, whether that's just going into your room, shutting the door and locking it. And if you're a parent with kids, you know you've done that before.
And that's why we have to put that plug in for women. I will just say that to you.
Once or twice in your life.
Do that.
Self-care is not that drink every day after work, because that over time can be detrimental to your overall health. And so we've got to have that mental health care. Finally, I will say this, and the last thing I'm going to say about the pandemic, doctors, understand I'm going to stay partially neutral. And I'm saying this, that getting vaccinated is a personal decision. Spreading misinformation is also, it is dishonest, right? And so if you make a personal decision to not be vaccinated, that's your decision. When you're trying to make other people, sway other people to that decision you've made, then that becomes, what is your goal, right? Because what doctors are doing, you say, well, doctors are on here, they're telling us to get vaccinated. They're following the science and medical science about how vaccinations help our immune system. So that's what they're doing. And they're saying, hey, the best thing to do, the numbers support being vaccinated. That's what they're doing in terms of that. So I wanted to say there's a real difference in you pulling from some website and posting on your social media and saying they're trying to distract you, and really that's not what it is. Have it be a personal decision, but make sure that decision is based on true facts from daily medical professionals. And if you see on one side of the ledger there is every organization on demand and all saying get vaccinated, and on the other side of your ledger you've got a couple of obscure websites and some really highly politicized, channels, then you've got a way where your information.
And then you know what? Let's not forget who is dying. And as I said, it's Black boys of Latin descent, Latino descent. It is communities of color. So let's also pay attention to that. So if we care about ourselves, and we care about our kids, because I said I'm going to use every tactic possible and guilt people. If you don't care about yourself as adults, I know you care about the kids in your life.
Right.
Please get vaccinated.
Right.
Absolutely. So I will just say this. Thank you all. This has been therapeutic. It's stressful, and Dr. Gigi knows in my role here, I have to be, I have to know about everything with regards to the vaccine. Right. And so I talk to professionals every day. I read articles every day, and I scour social media and find out what people are talking about on a daily basis. And so we'd have to be on top of this. And so if you have some real questions, I would say that I would encourage this, because Leggins on YouTube, I see your question, and I will say this: the person that you talk to the most, your doctor, your own personal doctor, should be the person that you have that conversation with. Right? Not Google, not social media, not diving into the echo chambers that get created on social media. This is when we're talking about making that personal decision, that decision should be made with your doctor. And because you might have, if you're immunocompromised, if you've got some other conditions that could prevent you from being vaccinated, then that's a decision that's made between you and your doctor. And then y'all talk about steps to prevent you from becoming infected. If that is not the case, then you need to have that conversation with your doctor as to what your reservations are with regards to being vaccinated, and not have that out on an open forum with social media. That's my thing.
Can I just add to that?
Yes, ma'am.
I also would like to say this is a great time, and it's a PSA. Get a personal relationship with a doctor. Part of the problem
that's true.
That, I mean, this is really the problem. Many and studies have showed, and this is somewhat why we are the ones being affected and disproportionately affected. There are studies that show that a large percentage of Black men, Black women don't have a primary care physician. So if the only thing you're using is the emergency room when you have a problem, that is not the time that someone has to spend to give you these answers and talk to you. They'll try, but you may not get this personal conversation. The 15-year-old boy I had a conversation with today, I'm his primary care physician. So he was able to ask me those questions. So this is a good time to realize one of the reasons we're talking about Medicaid for all, and one of the reasons we're out here trying to get everybody insured. This is why Dr. Gigi and I do the work we do with healthcare disparities, because when we don't have personal physicians, we are going to go with this information on the internet. We are going to go with whatever, crackpot we see that might have a white coat on, that's saying some things and spewing some things, and we're taking it as truth. So this is the time to recognize that we do need physicians, guys. You need a relationship, nurse practitioners, physicians, someone. But this is the time you need a personal relationship so that we can have these open dialogues and we can be here to answer your questions, and that you can.
And as part of our work at the Rodham Institute, we push for more and more young people to go into health careers, because studies show when Black men see Black male doctors, guess what? Their outcomes improve. Because it is that personal connection, because that doctor is going to say, hey, look, we got to get you checked out for the prostate cancer. The recommendations for the population are X, but for you as a Black man, this is what you need to do. Instead of somebody who may not have that understanding or experience. Oh, you don't want to test? Okay, fine, no problem. Say, no, actually, this is a significant, deadly problem among Black men. You need to get this done. That's going to be very different. So dismantling the medical apartheid system takes many different forms, and there are many components. There is the individual speaking out for himself or herself, getting family members to come along with you if need be, especially if you're getting a highly charged diagnosis. It is about working for the rights of patients in general, but it is also about supporting more and more of our youngsters, our youth, to go into health careers. And it doesn't have to be doctors, right? It can be nurses, it can be a physician's assistant, a physical therapist, radiology techs. It's the whole gamut. Because guess what? When there are more of us, there's better treatment. And that's what the study says. It's not just what Dr. Gigi says. Although I also say it.
and that is absolutely true. Dr. Gigi is speaking directly from the studies are absolutely true. And the studies are mirroring what's happening in the workplace. And so if you need a Black doctor, you can go to blackdoctor.org. There is a doctor locator. You can try to find a Black doctor in your area if you want one. The positive thing that came from, if there's one positive thing that came out of the pandemic, is that telemedicine has increased significantly over that time. And so you can find a Black doctor who may not be in your city. You can do telemedicine, and you can get your lab work done in your city and let them see your lab work. So there are ways to work around it. If you really don't feel comfortable and don't have a primary care physician in your area that you feel comfortable with, you can telehealth and telemedicine and find somebody that you're comfortable with. The most important thing, as Dr. Yolanda said it, is have a relationship with the doctor, but understand that you are in the driver's seat of your own health and wellness. Your doctor is navigating there and giving you the directions, but you're in the driver's seat.
And we're partners. We're partners.
Exactly.
Those of us who really understand it, we are partnering with you. And what I tell my parents all the time about the care for their children is, I'm just a partner in this. If you think you see something, don't wait on me. tell me about it. And I work for you. You are my boss when you walk in there. I work
Yes.
for you. And that's how we need to see that that we really are serving our communities. We are working for our families. And so you're likely to have that relationship more often with someone who looks like and has experiences like you. But we really are here to partner with you.
Absolutely. So please learn about anything that you have questions about. Go to blackdoctor.org. Go to sites that you trust that are legitimate health and wellness sites. Learn about it, and so therefore you're becoming more informed when you do go in for your doctor visit. So we're doing a series now called Operation Life: Back to Basics, and we're breaking down all of those illnesses that disproportionately affect Black Americans. You can go to our YouTube channel. You can go to blackdoctor.org. We did cholesterol a couple weeks ago. We did hypertension. Tonight we did asthma and COPD. We've got prostate cancer coming up. We've got a series, fibroids, all of these different things that you can come here. But eventually, you can't just sit here and watch Facebook Live. Eventually, you're going to have to go in and have a conversation with your doctor. But we want you to be your own best health advocate. We want you to be better more adherent to your treatment plans. And we want you to have the most positive health and wellness journey that you can have throughout your lifetime. So again, diabetes is coming. Jackson, we know diabetes is coming, and I've learned so much about diabetes. It's very so. Just go to blackdoctor.org, Barbara. If you want to know what sites are legitimate, just go to blackdoctor.org. But I will say this: the sites that are legitimate, the ones that you see pop up many, many times, right? So if you only see it in certain locations, then you got to question.
Well, actually, a good guideline is if it ends in .gov or .org, there is no commercial interest. Remember, .com means that there is a commercial interest.
Right.
So .gov.org, that's just a good way to, in general, not just for health information.
And that's a general. And then again, and if you see that same information repeated out, across multiple sources, then it's probably going to be pretty legit. Now, again, that .com, especially about health and wellness information.
Exactly.
You might want to.
Got to be careful.
Step away from it.
But can I just say, just like a shameless plug for Dr. Yolanda Lewis-Ragland's Navigating the Triple Pandemic. The thing that's so rich about it as a book is that it's stories, and it's stories where we can see ourselves in it. And even if you're not a clinician, but we're all caretakers in some shape or form, unless we're children, right? But it's very powerful. There are stories that resonate, and as my friend, I just want to support her work, and I want to get this out into the medical schools, the nursing schools, because I think that we need to educate some of our white mainstream colleagues about these issues. I don't think they sometimes have a clue about the kind of burdens that we're walking around with. And if we're going to dismantle this medical apartheid system, we need our white allies. We need our white friends. We need to educate them, and without having to always explain. So you could just say, hey, read this book, and then we can have a conversation. And before I forget, can I just give a shout out to Ms. Lanita Gaines, who was watching. Hey, Ms. Lanita, hope you and the family are good.
Well, I want to say shout out to everybody who's watching. Lorraine, you've been great. Barbara, our people that are watching on YouTube, Leggins, thank you for your questions. We appreciate that. Again, we want to treat everybody with respect and give you the respect that you have as human beings. We want to answer your questions in the way that you can get the information that you feel comfortable with and that you can take and use. And so, again, if we, but again, we are very passionate about people. I am an advocate for the vaccine. I will not shy away from that, but I'm also an advocate for you to be able to make that decision and feel comfortable in making that decision for yourself. But I'm going to help you get the information that you need in order to be able to make a more informed decision with regards to being vaccinated. So
my shameless plug is that volume 2 of Navigating a Triple Pandemic. The subtitle of that is COVID-19 vaccine, virus and vaccine, facts, fears, and fiction. And so the second book is another set of nurses, physicians, and pharmacists And they're telling that second part of the story about how, as Dr. Gigi was saying, we've been sort of burdened with having to become experts. You know, as a pediatrician, I've been talking about vaccines forever. You know, I've been always in this anti-vaxxer conversations, but many of our dermatologists have become experts on the vaccine because they're a Black doctor and someone wants to know about it. You know, so just our average physicians who are just really going in and deciding, I need to know as much about this vaccine and this virus as I can, because my family members are asking, my community is asking, my patients are asking. And so this book, the second volume, is talking about the facts, fears, and fictions about the virus and about the vaccine. And so it's another set of authors. And a shout out to Dr. Kiana Nix. She actually did a comment on here earlier. She's watching. She's an author in book 1. So I just wanted to say thank you for the support.
Absolutely. Absolutely. So we're going to make sure we do that. And until that book comes out, get the book. Till that book come out, go to blackdoctor.org COVID-19 resource page. We got a resource page that gives you all that information. So this has been a wonderful kind of a cathartic experience for us tonight. Hopefully, everybody that was watching, thank you for staying with us and you got something from this. We're going to re-air this program tomorrow. So if you know somebody that could utilize this information and just kind of needs to hear that, it'll be on tomorrow at noon Eastern. We're going to re-air this program. So make sure you tag a friend, share it with your friend, and let them know, hey, there was a great program, House Call with Dr. Gigi. We look forward to seeing you all in a couple of weeks where we have another guest on with Auntie Gigi. And you will see Dr. Yolanda.
Dr. Auntie Doctor.
And you will see Dr. Yolanda here again on blackdoctor.org because we plan to have her back on a regular basis, whether it's talking about childcare, obesity, pediatric, the virus, vaccine, whatever you need to know, Dr. Yolanda will be here. So again, thank you all for joining us, and we will see you next time.
Thanks, guys. Thanks for having me.